Hello. Do I have to do like the YouTuber voice to get people to watch this? I don't know how to, I can't do it. Hello friends, acquaintances, potential new employers. Hi mom. This video, as you can tell by the title, is about my nose job experience. So if you want to hear all about why I did it, the moral and ethical implications of why I did it, the recovery, the before and afters, and if I'm happy with it, the most important question, then keep on watching. So what prompted me to get a nose job? I didn't like the aesthetic of my nose. It was a little crooked. It was a little bit high like that. What's that called? I don't know what that's called. But it was like a hook and it went down. I can still touch my tongue to my nose. So we didn't change a lot, but I wouldn't go as far as saying that I had low self-confidence. I don't know why people always talk about people that get plastic surgery as having low self-confidence. It could just be your nose or whatever doesn't fit your face. You feel like you should have been born with something else. I felt like I should have been born with a different nose, but I mean, whatever. Yeah, my nose just didn't look like anyone else's in my family. I didn't like it on my face. And I was never the type of kid to be, you know, shy and not self-confident, and I wore like feather earrings and purple lipstick to school. You can Google me, look at my blog, go back to 2009. There's some weird So my parents finally agreed to let me do it and support me when I was 22. So that's 8 years of me wanting it. And I would say that's a pretty standard amount of time that someone should, no, I'm kidding. Yeah, I would definitely give it like a year of you wanting something like that, like to go through something that intense. And you have to ask yourself, is it because I have low self-confidence? Is it because my mom or dad wants me to look a certain way? Or is it because I just like the aesthetic of a different nose or a different whatever? Thankfully, I have parents that don't comment on my appearance in a negative way. More than 2 to 3 procedures, I would say, like, question why you're doing it. That's when it gets tricky. Finding a doctor. Google real self, read reviews. I only saw one other doctor before, or surgeon I should say, before I chose mine. And the reason why I chose him was because of his videos online. He talked about how he has like these no's in terms of nose jobs, and like one is a pencil nose and one is a piggy turned up nose, and those are like my 2 no-nos. Oh my god, ridiculous. I am ridiculous. Okay. Those are the 2 things that I would be really unhappy with. And the reason why I wouldn't want a pencil nose, everyone in LA has one, and it looks pretty, but after 10 years it's going to collapse and they're going to have to get another rhinoplasty to fix that shit. And I don't want to go through with that. And I wanted something that looked real, that looked just like a refined version of my nose, and that is what Dr. Rady Robban was going to give me. So I met with a different surgeon prior to booking with my surgeon, and the reason why I didn't choose him was because he didn't seem super interested in me as a client, patient, and the reason why was because he had his own TV show, he was working with another really famous doctor, and it just seemed like I was a routine procedure, whereas I wanted someone who was super invested and actually cared about me. And one thing that my surgeon didn't do that a lot of others do is they give you like a Photoshop rendition of what your nose is going to look like, and that I feel like it's super misleading because you don't know if it's going to turn out that way, number 1. Number 2, it's just like, oh, move a little up, a little down, and the person's like, okay, it's going to look exactly like that, but in reality it doesn't look like anything. Like you can't predict what it's going to look like. So yeah, you can tell your doctor exactly what you want. I came in with a bunch of photos and I knew exactly what I wanted changed about my nose. Whereas he said some patients come in, they just say, I don't like my nose, and that doesn't really help your doctor figure out like what should I do to fix the nose? He explained to me that the closer you are to perfection, like he said my nose wasn't that bad, so the closer you are to a perfect nose, the harder it is to get you any improvement. But I was in a state of mind where I wanted anything to change about it, like any slight change, any slight improvement would have made me super happy. So I was cool with that. I knew I couldn't really, you know, dictate exactly what I couldn't, like, I wasn't gonna get exactly what I wanted. And I wanted like tiny nose, and he was like, okay, that's not gonna happen. And he gave me the reasons why, because I just don't have the facial structure for that. So yeah, I've heard of girls getting like 2 to 3 rhinoplasties because they just weren't happy with their first one, and that kind of scared me. So do your research, because if you open up the nose again, there's scar tissue. Healing takes twice the amount of time, and if you've done any research about nose jobs, you know that it takes a year to heal, to get to its like final state. I'm losing the sun, no. So before the surgery, I spent a lot of time placating my family. They were scared about intubation, about the anesthesia, because with a tube down your throat, you can have a collapsed lung, you can have this, you can have that. And yeah, since they're all in the medical field, I had to get them to calm down. And that distracted me from realizing that I was scared shitless. And of course I Googled what like the procedure entailed, and I'm not squeamish, so it didn't bug me that, you know, it was going to be bloody or whatever. But what bugged me was that my nose was going to be peeled open, because I had an open rhinoplasty. I think it's called like an open septorhinoplasty with inferior turbinate reduction is the exact term. So yeah, a week before I was like on vacation, and then I moved to my new apartment, and my mom was with me, and 3 days later I had a nose job. So it's like a lot of shit was going on. I was super stressed about it. And so like the week before, 2 weeks before, you have to avoid like certain foods like garlic, chia seeds, and some medications, because they have an effect on your heart, your healing time, your blood. So if anything thins the blood, you can't be taking it because you'll bleed a ton during surgery, and that would not be ideal. Vidse of, my camera is dying and I don't know how much time I have left, but we're gonna go for it. So I had to sign off on a bunch of shit, and it was basically like giving them the right to take a fascia graft from my temple, giving them the right to take cartilage from my ear, bone from my rib. He said that the only thing he would probably do is take a fascia graft, and thank God he didn't, because that freaked me the fuck out. And then I had to sign off on if it was a 6 to 8 hour surgery, I would possibly have to have a catheter inserted to pee, and that is inserted exactly where you think it is. Anyway, I was scared of the anesthesia because of the movie Awake, and I know that's like super rare, but I was still scared. And so the anesthesiologist, I'm guessing she's heard that a lot. I didn't tell her, I don't think, but she came in and she was like talking to me and my mom for like 15-20 minutes before the procedure, and just, you know, making us feel a little bit better. The doctor like marked up what he was doing, and I had a bunch of pen on my nose. That was lit. Anyway, I got into the operating room. They were playing like heavy death metal, and so I was like, what the f-? Like it seemed like this was like fun for them. I don't know, it was weird. So I got on the table, and she like injected me with something, and I was like, I had this like small like desire to jump off the table and run away and like not go through with it, and that desire came as she had already injected me with medicine. So everything went to black, and the next moment was me waking up in the recovery center area, and I thought that they were taking like a surgery break, or like that something had gone wrong and they needed to like take a break for a second, which is not a thing. There was just like it was done. So yeah, that was not a thing. But I was loopy, and it went in 4 hours. They did it in 4 hours. So that was a relief. No catheter situation. But yeah, there's this like moment also before the surgery where I was like, oh shit, what if I didn't show up enough photos? What if like he didn't get my vibe that I wanted? And like that small moment of fear, I kind of like regret not showing him more photos because that made me super scared for a little bit. But he totally got what I wanted. He was super on top of it. So no regrets there, besides the fact that I could have saved myself a lot of anxiety by just being super annoying and being like, this is what I want. Yeah, he didn't have to take the graft or whatever, and like he kind of just set me up for a really difficult surgery. He was like 6 to 8 hours, catheter, graft, this, that, and it ended up being like 4 hours and like super chill in terms of how chill a nose job could be. So the worst part of it, not gonna lie, was just the drive home. It was an Uber with my mom, Uber Black, and I was groggy. The pain medication was wearing off. I was being bumped around. I was trying to sleep. Kind of nauseous, not really. I never vomited through the whole process, so that's great. They gave me some good drugs for that in terms of the anesthesia. They mixed a couple, I think. So my mom helped me out for a few days. I was off the pain medication in 72 hours, so that was pretty exciting. My mom actually just like would not give me the medication every whatever hours it was. She would give it to me when I was like absolutely like needed it, when I would start feeling the pain, which it's prescribed to take like on, you know, a certain schedule. But I kind of preferred that way that my mom wanted me to do it, just because the less drugs, the better. And so basically you have these glorified tampons stuck up your nose for however many days your doctor wants to do that. Mine did 7, which is like unheard of. That's a really long time. But I didn't mind it that much. Like, I was on the medication, the pain medication for the first few days, so I was like sleeping all day, and albeit it was like 2 to 3 hours at a time, but it was fine. Like, you wake up because your mouth is dry and you need water, so you have humidifiers which help like lubricate that situation, and you have to pee a lot because you're drinking a lot of water, and so that's uncomfortable, but it's not like a big deal. Like, you want a nose job, you want a new nose, just deal with it. So yeah, you sleep with your head elevated to reduce swelling. Thankfully I didn't have to sleep sitting up, which I've heard people had to do. I had some bruising and swelling, nothing crazy. My eyes didn't swell shut, thank God. I do wear glasses and contacts, and I hate contacts, so I had to start wearing them because you can't wear glasses for 2 months. And they have this like little note, they're like, you can tape them up to your forehead. I'm like, I'm not gonna do that, that's weird. And then you have this like little like piece of gauze that you change out because it gets bloody, but I didn't have any blood gushing out or anything. So this is what I looked like through the first few days. I would say that the second to third day were the worst. I didn't even take a photo on the 10th. I think I took a Snapchat, but I didn't include that here. So my eyes didn't swell shut. I had bruising, not that bad. It looks worse than it felt, to be honest. But yeah, I look real rough on August 9th, not gonna lie. So yeah, my mom left after a few days, and then my sister came to visit. I couldn't taste food, which is actually the most annoying part of having those things stuffed up your nose. I didn't even realize that would be a problem, but I was eating like a bunch of cereal, applesauce, and some like lentils, and I couldn't taste it, so that was really annoying. And I couldn't have coffee. The coffee thing was hard. Not gonna lie, no coffee for 2 weeks because it increases your blood pressure, which increases swelling, which is not good. It was actually funny because they said I could have the glorified tampons, I don't know what they're called, taken out, packing, taken out one day early, but my mom was gonna come the next day to go with me, and so I was like, yeah, you know, I won't go. And I was able to drive after I got off the pain medication, So I was willing to go another night, like a full 7 nights with the packing in my nose. So that should give you an idea of how bad it isn't. So showering, I used a bucket, no big deal. Couldn't get the face wet, obviously. I washed my hair like twice, which I usually wash it every day. So that was kind of annoying, twice within like a week. So the tape stayed on for 14 days, which I had timed this so that when I would be going back to school, it would be off. But I had to go back to school the first day with tape on my nose, which is hilarious because it's USC, and I'm sure that's not the first time teachers have seen that, and it's not the first time people have seen that. No one even like gave me a second look like, what? But it's USC, so that's why. And I think when I got the tape taken off is when I had to get the stitches removed, which was not painful, not bad at all. You have like a bunch of nasal sprays, you have a bunch of like rules about not working out and like all of that. The scar did heal. You can see the scar a little bit, but I don't mind because I'd rather have an open rhinoplasty than a closed one, because a closed one, like, you can't really see what they're doing. My surgeon doesn't even do those, but the healing time is much quicker for those. So yeah, when the tape was taken off, I immediately loved my nose. You have to add a piece of tape right here for like a couple months every night to help reduce the swelling. And I would say that most of the swelling goes down within like 6 weeks, but my nose looked the way that it does now around December. So yeah, not much changed after December, even though they said like it takes a full year to heal. So the photos that were taken in the top left corner on the 16th, that was the first time I got to see what my nose looked like. I left with the splint that you can see in the top right corner. I wore that for a few days, and then finally on the 23rd I had to wear a piece of tape for 24 hours, and then for every night after that I taped my nose like that for about 3 months. Something that no one told me was that how tired you would be in a recovery process from surgery. I was tired all the time for a few months actually, so the fact that I couldn't work out wasn't a huge deal, I guess, because I kind of didn't really want to. I was tired, and I guess my body was healing itself, so it needed all of the energy and resources to go towards my nose. Yeah, people didn't really comment on it. When I would run into them, no one really noticed. I told my close friends, of course. I Snapchatted about it a little bit too. So here are the before and afters, and as you can see, the biggest difference would be the profile view of my nose. So before this, I would contour my nose and do different, strategies with photos and makeup to make it look smaller. But though the difference isn't that huge, it made a big difference for me. I just got more comfortable with it, and I'm really happy with the result, and I'm super glad it doesn't look fake or too done or anything. And I actually just don't even wear as much makeup anymore because I like my nose and I like the structure of my face, and I'm just happy with everything overall. So, to sum up, I'm really happy that I got to do this. I would go through it again in a heartbeat. I've literally had colds worse than going through the recovery process of a rhinoplasty, but I've also heard horror stories because everyone's experience is different and everyone's pain threshold is different. And I was also lucky because my nose was not broken to begin with. So if your nose is broken to begin with, I don't know how your experience is going to be. But yeah, so just remember that body modification it runs rampant throughout the world. It's not just an LA thing. It's not just a low self-confidence thing. It's like, if you don't like something about yourself and you have the ability to change it, why the hell not? What else? I think that's it. I think that covers it. I'll probably add some photos to this. I'll try to figure out how to use Final Cut Pro because I don't know how. Yeah. Okay. Thank you for watching. If you have any questions, let me know. Comment, like, subscribe. Just kidding. I'm not a YouTuber. I don't know if I would ever make another video. This was just because I knew no one would watch or no one would read a 5-page like soliloquy about my experience with plastic surgery.